The title of this presentation is MRIs, Past, Present, and Future. In 1937, Professor Isidor Isaac Rabbi, a Columbia University professor, observed quantum incidents called nuclear magnetic resonance, otherwise known as NMR. Other scientists soon learned that when the second magnetic field is moving backwards and forwards at the right frequency and makes contact with the atoms of hydrogen does a 90-degree spin. When the second field is removed, the nuclei return to their original position. In 1971, Raymond Damadian discovered during an experiment on rats that cancerous tissue had a longer relaxation time than in healthy tissues. This experiment led him to believe that he had found a way to detect cancer. He filed for a patent on this finding, but it did not describe a clear method for the NMR in scanning the human body. It is also worth noting that he is credited as creating the first MRI machine. In 1974, Paul C. Lauterbur on the left and Peter Mansfield unwittingly described the use of magnetic field gradients for spatial location of NMR signals during the same time period. Peter Mansfield is from London. The two of them came to this conclusion around the same time from different parts of the globe. This led to the foundation for the magnetic resonance imaging, otherwise known as MRI. In 1977, Raymond Damadian was the first to perform a full-body MRI on a human to detect cancer. He found a way to use NMR to safely scan the human body. As you can imagine, this breakthrough improved healthcare around the world. How MRIs work in the present day. The MRI scanners uses a very strong magnet. The magnetic field aligns protons that are inside of the hydrogen atoms. These are aligned in a parallel line alongside the magnetic field. Short bursts of radio waves are sent from the MRI machine into the patient's body, which knocks the protons from their original position. When the burst stops, the protons are realigned, creating radio signals. Once these signals are detected by the receiving device in the scanner, the receiving device transmits the signals to a computer, who in turn creates a picture based on the radio signals that were emitted from the body. Because it uses the magnetic properties that are in organs and tissues, the MRI does not emit radiation to the body like the X-ray machine that gives out ionizing radiation, which makes it safer to use. By using magnetic tracers, scientists in Hamburg, Germany developed a technique otherwise known as magnetic particle imaging in 2001. It is a more sensitive and safer alternative to the angiography that is currently being used to assess heart disease. Instead, the machine uses tracers rather than chemical contrast agents used in angiography procedures, which benefits those people with kidney disease. The price of MRI scans can be expensive. Each year, MRIs cost about $18 billion to perform. The prices can range from $1,750 up to $2,200, depending on the hospital or the healthcare facility. For these patients that have health insurance, the prices for the MRIs may be covered and the out-of-pocket costs a lot less. Although the cost may be high, the patients are a lot better off having MRIs. The procedures in the MRI can give the patient a lot of relief knowing that it is a better way to diagnose problems. This can give the patients more confidence in their doctors. In the end, Both sides are more than satisfied.